3 years, I continuously feel pain at my right side. I hear a lot about hepatitis and that hepatitis is killing people. I was afraid to go to any hospital because the fear and the thought drained me. But when my eyes stayed yellow and I couldn't take the pain, my friends took me to Dr. Marina's clinic. To my surprise, it was a gallstone in my liver. Just few medicine, herbal tea, serious diet, and only 2 months. I wasted time and nearly died. Thank you, doctors from Diamond Hospital, for saving my life. Trust me, she's just the best.
Hello viewers! Today we are continue cycle of our programs about the diseases, internal diseases which can be difficult to detect, and the solution for it is just has a lot of complications. We will discuss today about the prostate enlargement. How the scientifically tell this is a hyperplasia of prostate. Normally the people tell prostate enlargement. From where it is coming and how it is created, today we will discuss with our MPhil in pharmacology. This is Dr. Joshua Asante.
Okay.
Doctor,
Yes.
tell please, you are just make scientific research. How we know that now more than 70% of the men in the age of 50 plus have this problem? What is happening and why it is affected that huge quantity and population?
Yes, we understand that prostate enlargement, like you mentioned, hyperplasia of the prostate is a major problem with males, especially 50 years and above. But now we are even realizing that young men in their 30s also have this problem, the prostatic hyperplasia. It starts from somewhere. That is the root cause. From prostatitis.
And what is the cause of that prostatitis?
Infections.
Infection. And from where the young boys can pick that infection?
Urinary tract infection can be picked from anywhere. Public facility is one. You see, in our tropical region, the young boys at the very young age to the puberty, they are always bathing in the streams, in the water bodies, which has a lot of infections, both bacteria and parasitic. And then at the puberty stage, when they are sexually active and they start to have the sexual intercourse with different partners, they are picking one infection from one partner to the other. And these infections staying inside and travel to the prostate gland to cause first prostatitis. This is inflammation of the prostate gland, which will cause swelling or swelling of the prostate. If this is not treated,
but is it painful? What is the symptoms? When they start to have that prostatitis, is it painful? What is the symptoms of it?
Sometimes at the initial stage, you might not know. You might not have any
Ideas.
big symptoms. For instance, if a young boy is having frequent urination, the first idea is urinary tract infection. They will never investigate the prostate. They do urine test, detect that it's infection, and they give treatment for the urinary tract infection.
Just antibiotics.
Just antibiotics. But they will never investigate the prostate, that they have inflammation and the cells has started growing bigger and more. So this problem will stay for a very long time. Then at a later stage, after 35 years, 40 years, and then 50, the enlargement is coming. This is one aspect. The other aspect is hormonal, as you know, like the testosterone, and then lack of sexual activity. We know the function of the prostate.
Okay, the function of the prostate is just producing liquid and producing the testosterone. It is just liquid supposed to help sperm, which is producing inside in the testicles, in the scrotum, to push it out through ejaculation.
Okay.
And when the man has a lack of sex, it means their libido coming down. Why they don't have sex? If the young age they have and just go in 35 and don't have.
Because the testosterone hormone will be dropping.
Why it is dropping?
And
What is making dropping?
what-
If you are the man, if you are active, why it is dropping?
from previous lifestyle, infections can cause inflammation of the prostate.
Okay, inflammation.
And then it will affect the prostate function. Because the prostate must produce these hormones. And you have inflammation of the prostate.
That it is stop
It
producing.
is not producing enough testosterone. This will decrease your libido and lack of the sex. But the other function of the prostate, that it produces prostatic fluid, is still continuing.
And the prostate like a ball.
Like a ball. You are-
Continue growing.
yes, you are
bigger.
producing the liquid every day.
But it is not pushing
But
out.
it is not pushing out. So it will stay inside, make it grow bigger, and when the liquids stay inside for a very long time, it will begin to form crystals too.
Calcification. This is why we are just, when we are doing a scan, now in the age of 30 plus, it is every second man has calcification. I
Of
think
the
it is maybe additionally like nature of the job, nature of our lifestyle.
This is one aspect too.
First we are sitting in the school, 10 years, then we are going to university for the 6 years, then we are going to the office, additionally always sitting, and plus from the office to the house in the car. In the house we reach, we just sit with
Watch television,
watch
we are
television,
sitting,
like it is deficiency of the physical
and
activities.
we are tired. We don't have any sexual life because we are tired from work. Long sitting,
It means it is a stress, like job giving us the stress,
very good.
and that stress is affected libido.
Libido, and then blood flow. Because when you sit for very long,
Deficiency. Like it
deficiency,
is congestion.
congestion,
Like pelvic part is
blood
just
is not
developed
able to
congestion.
flow well. So, men who have urinary tract infection, chronic infection, and who are also working in the office, and they are given antibiotics. These antibiotics are not put directly into the prostate. They are swallowed, must go into the blood, through blood circulation must come to the prostate.
And it is not coming
And
because
it
they
is
have
not coming
congestion.
because they have congestion. How do you treat this
Prostate.
infection? And
And
prostate
the
enlargement.
inflammation is not possible because the congestion is there.
So lack
And
of
the blood is not
it's
entering.
not flowing to carry the antibiotics for effective treatment. So like you mentioned, our physical activity, lack of physical exercise, like the man you're supposed to walk, prevent long sitting, like you sit in the office for maybe 1 hour or 2 hours, you need to stand up so that you reduce congestion and then the blood can flow well to the prostate. This is one major cause of prostate enlargement. And then the lack of sex. As we
This is a
also
lack,
mentioned.
lack of sex. We discussed that it is a stress. Then it is just like a psychological aspect
Yes.
and points which is just affected. That may be business problems, some of the problems, financial issues, just create a stressful situation that the libido is coming down.
Yes.
Libido coming down, prostate grow big.
Yes, because even from research and then literature, it is published that men after 35 years who do not ejaculate 21 times in a month stand the risk of getting prostate
21 times in a month.
In a
It means
month.
every day or it means every second day. 21 times.
Yes, to push the
Or it is
prostate,
a morning, evening.
it means you
half-
have to
half-
divide by
half-
the week, maybe
half
3,
of-
4,
half-
5 times in
Half
the week.
months we ejaculate and half months we just have a rest.
Yes. So it
It
is
is really
a very interesting aspect that now when you take men, 10 men, you have more than 7 or 8 having prostate problems.
Well, this is because of the hormones is not producing. How you are telling? Nature of the physical activities. That very poor physical activities, and physical activities just blood is not circulate, libido is not coming, and it is just create. But how I understand, doctor, that the hormones It is a fertility hormone androgen. It is produced inside in the pituitary gland.
Very good. So you see, normally patients who have problem with the prostate, they have impotence. One, the hormone which will increase their libido is low. And this hormone is controlled from the pituitary gland to the andros, like the androgens, these hormones that are supposed to be produced, is controlled by the brain. So lack of sex and impotency is also linked to the function of the brain. Like
Okay, this is like how can I just understand the problems? That libido, it is just like neuroregulation, neurostimulation. That if the neurostimulation is absent, our brain is not activating that hormones which is supposed to give erection. This is like necessary to take attention that the man supposed to check about and take a control for his sexual life. That if he start feel like his libido is just start coming down, that it is something wrong with the neuroregulation in the brain. That need to take attention, everything is well or not. That we can just invite them, because how I know like this Parkinson's disease can be creating because absent of the neuroregulation. Maybe it is neurons that the wires which is supposed to bring signal to the penis, it is just breaking on the way. It is just develop and create that problems.
Yes. So you see, issues with prostate, early detection is very important. When we detect early, because it can start from prostatitis. Simple urinary tract infection, if not treated well.
This is, I understood that we mentioned it already, that necessary to treat bacterial infection, necessary to boost blood circulation, and how I understand that if we have a nature of our job that we are always sitting, how we can boost that circulation? If even the people using the medicine to boost erection and other, how I hear like if they take Viagra, it is give the negative impact. Like a feedback, it is just affected brain that it is stop react for that medicine. That a part of the good points what they suspect, it is giving the that negative impact. That a part of erection it is coming impotency. And the medicine what our center is giving just to boost the production of the testosterone and to boost the libido. Because we have, how I know that we have 3 products which is just boost libido. We have a product which is boost spermatogenesis, and it is boosting everything. And we always advise the people to make a physiotherapy.
Yes, to dissolve the crystals.
Dissolve the crystals first.
Yes, to increase blood flow.
To increase the blood flow, and to help the medicine what we swallow to enter inside to the prostate, to dissolve the problems inside.
Yes, but how do we massage the prostate? Because there are other facilities where you visit and they have to use the fingers.
Yes, this is
the anus. This is uncomfortable.
No, this is of course it is complicated, and the people they are not happy because it is so painful. Especially if you have inflammation at the prostate, it means you have a swelling tissue around. And if they start manually massage the position, how the people put there, and the procedure itself, it is so painful. At our center, we just offer some of the devices.
A special machine you will not find anywhere.
You just can apply it, and it is a triple function. Magnetoflow field and the thermal field, and another is just helping all crystallization, calcification, negative bacteria taken out to the lymphatic stream, and everything is just shrinking and dissolved. That in this case, just let's advise our viewers that if you are in the age 30 plus, and if you feel any of the discomfort, like frequent urination, movement inside the penis, some of the pinching, inching, some of the pimples is growing on top of the male organ, we advise everybody, don't sit at home, come to our place. If you detect and diagnose that you have enlargement of prostate, don't sit at home and wait that if you start urinate and forcing urine stream to flow, or the stream is just divided on 2. You need to come, because this is some of the bacteria or swelling, which is just stream is divided on the 2 part, and it is just make power low that the urine is not flow normally. When the prostate grow enlarged, when the man lie down to the bed at night, and the prostate enlargement, which is pressing from the down to the urine bladder.
Yes,
And they start feel like urine bladder is not full, but because of enlargement and pressure from down, they feel like the bladder is full and they wake up always urinate. This is why the first question of the doctors is coming like, how many times you urinate at night?
Yes.
People telling like 1 time, 2 times, some is 5 times, some is 7 times.
Some they are
Even 8. Wow.
The more than 10. What they do is they are removing the stick from the broom. And they are counting when they go to urinate.
Wow.
They put it that way.
How many?
This is number.
Apart of go to hospital, they are just using the broom.
To count at home, it is a very uncomfortable condition. And you see, lack of good sleep in the night can also affect the kidney. So when
no, it is how we understood that all our body it is one system. If you are not sleeping well, BP is going high.
Yes.
If you going high, blood circulation is affected. Your vision start affected. That weakness, tiredness, and another coming, and it is coming nervosis. It is coming insomnia. It is just mental disease can be created.
Yes. It is very effective. You see, when we mentioned the aspects of prostate enlargement, now we know the root cause from where it is developing and how we can treat effectively to prevent catheterization, that it will get to a stage where they will have to put the catheter. We will prevent that. And even people who have the catheter can also come to us. We have the machine to help
to shrink
to
the prostate.
Medicine to stabilize the hormone, increase production of testosterone, to boost the libido. And then we will also advise you. We also have special exercises for the spine to increase blood flow, to make sure every connection.
To boost the libido.
Yes.
That who has that problem with the erectile function, who has erectile dysfunction, we have special physical exercises,
yes,
especially for the spinal cord, that the signal from the brain to the penis will be go normally and
straight.
straight.
No breakages,
No
like
breakage.
the light.
Okay.
To make you very strong and powerful to satisfy your sexual partner. We're taking this opportunity to invite all men, irrespective of the age. When you come, we will detect what is wrong with you, and to prevent is better than cure. If you also have prostate enlargement, you can also come to us. We have special medications which are natural, and the physiotherapy machine to massage the prostate. You can locate our center, Ghana in Accra, East Legon, opposite Legon University Sports Stadium, Oponglo traffic light. In Kumasi, we are at TUC Junction near Santase Roundabout. Takrade, you can locate us at Anaji, opposite St. Peter's International School. Tamale, we are at Kamina Barracks, just behind the Kamina Barracks, opposite Star Oil Filling Station. You can also communicate to us on the internet, www.dimedghana.com, and then YouTube Dimed TV. You can call the numbers which are shown on the screen for further inquiries. And then you can also go to our branch in Nigeria, Lagos, Victoria Islands. You are welcome to our health facility.